Neighborhood Health Watch is sponsored by the doctors of HCA Virginia.
Today in Neighborhood Health Watch, the topic is prostate cancer, one of the most common types of cancer in men. It occurs in the prostate, a small walnut-shaped gland in men that produces seminal fluid which nourishes and transports sperm. Some types of prostate cancer grow slowly and may need little or no treatment, but other types are aggressive and spread quickly. Dr. Kinlaw Nelson with Retreat Doctors Hospital is here to get us informed on First at 4. Thanks a lot for joining us.
Thanks for having me.
How common is prostate cancer?
It's very common. 1 in 7 men will develop prostate cancer in their lifetime.
And you know, I think most men are probably babies when it comes to doctor visits and that type thing. You're a man. Say something to the men in our audience about the prostate cancer, the screening, and what you think is important for them to, what the takeaway is.
Prostate cancer is a disease that is very common. Up to 1 in 7 men will develop it in their lifetime. However, it's a disease that's very treatable. If you find it early, then options for treatment include observation, as you mentioned, or more aggressive treatment for those cancers that are more aggressive. If found early, it's a very curable disease and the side effects of the treatments can be easily managed. If found late, however, that's not the case.
Early on, there are no signs or symptoms with prostate cancer. How should men protect themselves?
The best way to know if you have prostate cancer in an early stage is to go to your doctor and ask for the PSA blood test. There's also a physical exam that can be done where we check the prostate with our finger. The blood test is probably the more important of the two, but we like to recommend that they do both.
Right, and that latter part of what you said is probably what keeps them away, right?
That's true. And if you're really afraid to have that exam, that's okay. Go in and get the blood test. Tell the doctor you don't want the exam.
All right. And there's an important event that's coming up at Retreat on September 21st. Tell us about that.
On September 21st at Retreat Doctors Hospital from 5 to 7 p.m., we're going to have a prostate health event. We're going to be serving tailgate food, and then we'll have a couple of urologists there to talk about prostate health. And we'll be offering prostate cancer screening as part of that event.
And it's free. That's awesome.
It's free, yes.
What can a person expect? What should a man expect when they contact a doctor and say, I think I'm having these symptoms, I'd like to have a screening?
Sure. So when you go to a doctor and complaining about problems with urination, getting up more at night, for example, those are the common symptoms of prostate trouble. You should get a physical exam of your prostate where the prostate is examined for size and for any abnormalities that might feel like cancer. And then you'll get the blood test, which is simply a quick blood test. It takes a few minutes to come back with the results. If those are abnormal or concerning, then usually you'll be referred on to a urologist where we can make some recommendations for treatment.
All right, so it's easy. Get checked out.
Yes.
Screening is important.
Indeed.
Dr. Nelson, thanks a lot for joining us.